We are back on Taking Care of Business on Koerner Radio, News Talk, 1180, 1230 KGEO, and 1410 KERI. And our guest by phone is Rodger Bayne, Vice President of Group Benefit Sales, talking about Obamacare. Rodger, I got to tell you, this is such a great subject for Clay. He's biting at the bit. He's almost on top of the microphone. He just has so many questions for you. But I've got a question for the two of you. I saw a great interview the other day with a gentleman from Investors Daily, and he was talking about the fiscal cliff that we're teetering on. He's talking about, all these taxes that are going to change come January 1st, and Congress decided to go home because it's an election year, so they haven't done anything. Now we're looking at I think there was $46 billion is a number I heard in costs for small businesses in the first 3 years of his administration. Now we have a bunch of regulation waiting in the wings to take hold in 2013, and then you're throwing Obamacare on the mix. Can we handle this fiscally as a nation, or is this going to be enough to make this recession or depression even last longer?
Well, my feeling about the fiscal capability of this bill is that it was projected to be under $1 trillion. That was the whole benchmark during the attempt to pass it, is that we had to get the budget down. And so they projected $900 billion in cost. And the most recent estimate I've heard has now risen to $2.6 trillion. So we are almost a full 3 times more expensive, billion. So we've gone from 900 billion to 2.6 trillion. So we've gone almost 3 times the projected budget for this particular legislation already, and we've not even begun to examine the magnitude. But that's probably, to me, not the worst part. The worst part is that we are spending this outrageous amount of money and doing absolutely nothing to control or reduce the cost of delivering health care to American citizens. We are shifting dollars from one pocket to another and doing nothing to improve care or to reduce costs.
What can you tell us about the Life and Death Committee when it comes to the seniors?
I think most of that is gone. And there was a lot of discussion about that in the early portions of the bill. Some of those provisions were changed and edited, and what remains is much less innocuous than some people in far directions might want you to think.
Well, they also talked about the Medicare Advantage plans. I think either trying to get people to go into a Medicare supplement, or were they trying to get them to go into a Medicare Advantage HMO type program? Which direction was government pushing people?
Government was pushing to the Medicare Advantage plan for some time, in that their intent was to place the burden of managing the cost of this care on these commercial organizations that could manage that better and were specialists in doing so. The challenge, I've recently read an article where some of those organizations are paying physicians in hospitals a little bit more than Medicare would. And so they're being scrutinized on maybe spending too much on the Medicare Advantage types of programs and focusing whether or not they should be abolished or driven back into Medicare. I think there's really a middle-of-the-road balance that's warranted in these things, and I think that medical providers' resistance to providing care at the government reimbursement levels is also a major challenge.
Well, it almost says to me that the government believes that the insurance companies can do a better job working with the physicians and managing health care than they can.
Well, I think oftentimes that is true. The government doesn't necessarily get involved in managing health care, but simply managing the cost of health care by squeezing what they pay.
I keep hearing the term SHOP, S-H-O-P, exchange, for small employers. Can you go into a little more detail what SHOP is?
Yeah, the SHOP is, in fact, the health benefit exchange for groups. There are potentially 2 exchanges in each state. The state has the option to combine them into one health benefit exchange. The SHOP program is that which provides small employer coverage, and the individual exchange would be that would help provide the tax subsidies and premium assistance tax credits for individual consumers entering in the exchange to purchase coverage. Each of those has unique tax incentives and structures, advantages, eligibility requirements, etc. I believe they should be managed by the same exchange in 2 different risk pools. Some states are going in different directions, and those different directions make it more complicated for the consumer, unfortunately.
We're having a conversation with Rodger Bayne, Vice President of Group Benefit Services, talking about Obamacare.
You know, Roger, you talked earlier about 51 different programs or 51 different filings, each state having their own plan or plans, both in individual and I guess also in group. But what I keep hearing a lot of legislators saying is you need to be able to buy across state lines. Wouldn't this create a major disaster for people trying to figure out what's best for them or how to administrate this?
I'm not sure why this purchasing across state lines continues to rear its head. I don't know who thinks it's such a great idea. I don't know why they suspect it's an option that makes sense. Because I agree with you in that a consumer in California knows what California, or at least could learn what California benefits require to be covered. And then when he goes out and shops coverage across state lines, he could be looking at a state with considerably different sets of benefit requirements and considerably different pricing, and will potentially end up shopping price purely on the basis of the cost of coverage, only to find out that there are certain benefits that are limited, eliminated, or not provided in his coverage that he would have gotten had he purchased in his home state. The complexity is that now you're asking consumers to look at 51 different sets of what's covered for the same price and compare that price and the actuarial value and the coverage along 51 jurisdictions. It's bad enough now that they're picking from 10 different insurance carriers, each offering 51 different plans.
Yeah.
Now you multiply that 500 different options in your home state by another 51 jurisdictions, and I don't see it as fruitful, number one. Number two, there's no real value to it. They talk about economies of scale, and to me it doesn't have merit. There have been association health plans and multiple employer trusts that have come and gone in our country in the last 25 years that had hundreds of thousands of members from multiple states and sometimes millions of members in multiple states. And the economy of scale there was no different than it is for a national health carrier today. So I'm not sure where the advantage to buying across state lines is. I think it's driven by certain interest groups that want to be able to offer their insurance policies in other states because they domicile in a state with the least amount of regulation.
I guess that's the reason why we need these navigators.
Well, that's where a navigator would come into a very big challenge.
That wasn't really serious.
a little bit of sarcasm there.
I'm with you.
I've got a question for you. It's something that came up this week. Papa John's Pizza CEO said, okay, costs are going up because of Obamacare. A couple of weeks before that, the McDonald's CEO said the same thing. Are people really listening, seeing that costs are going to go up business-wise? And I know Clay and I want to talk about the effect on business pretty soon. So,
well, I've had to make some pretty difficult recommendations to a number of different people that don't always like hearing those recommendations. I suggested to one major breakfast franchise owner that their famous breakfast should just double in price if they want to provide the health care to their employees that they need to provide, because there is a significant new cost to many firms in this country that have not been providing care, and that cost could conceivably be much higher benefits to their employees and much more contribution, or a $2,000 penalty for every employee past the first 30. Now, this particular restaurateur owned 5 or 6 different franchises with some 450 total employees, had 26 of them on their health plan, and that would mean that they would have to add coverage for probably 200 of those 450 that were full-time but not on the health plan. And that cost would be expensive, and if they didn't incur that cost, they would have to pay the penalty for all of those not on the health plan. That would be a very expensive option as well.
Plus the full-time equivalents.
Well, the penalty is not paid on the full-time equivalent, but the full-time equivalent does help you measure the size of your employer.
Well, when we come back, let's let's talk a little bit about the effect on businesses. We'll be back in a moment on Taking Care of Business on Koerner Radio News Talk 1180.